Chapter 27, Assessing Health Status. Okay, these are objectives for this section of the uh, presentation. Okay, so a health assessment is the data collection part of the assessment phase in the nursing process. And so it can include things such as taking a health history, a vital sign assessment, a physical assessment, assessing their current health problems, and assessing any information that's pertinent to their daily care. And so when a patient is admitted to a healthcare entity such as a hospital, long-term care facility, home care, or any other type healthcare entity, there should be an initial assessment. The initial assessment is typically performed by a registered nurse. And remember, I said as an LPN, you will be able to contribute in the assessment phase of it by collecting data. So you will be performing data collection, but the initial assessment should be done by a registered nurse in most cases. And so, assessment is on a continual basis. You should be always assessing your patient. As soon as you walk in that room, you should actually be assessing your patient and the surroundings and things that you might see. A focus assessment is going to be done every shift. You should do a focus assessment every shift um, to assess, you know, uh, what's going on with your patient every shift, right? So, as the nurse, we need to be able to provide holistic care for our patient, which means we're not only looking at their physical needs, we're looking at all type needs. And so, a part of our assessment should also include a cultural assessment because our care plan should be individualized based on every patient and their beliefs and their cultural beliefs and things like that. And so a cultural assessment will include a wide variety of things such as how the person communicates, um, what are their hygiene practices, what are their nutritional practices, how do they cope with pain, because different cultural um, beliefs may view pain and how you express pain and cope with pain in different ways. Um, how's the physical exam going to be affected based on cultural, maybe um, if it's a female of a certain culture, then they're not allowed to have a male nurse doing the assessment or whatnot. So you want to look at all those things. Ask the patient and their family about um, like I said, personal care, what they think about their illness and their treatment. All those things will be a part of a cultural assessment. And remember, don't assume just because a person is a member of a certain ethnic group or culture that that person believes and practices everything that the group believes and practices. So the only way to find out what your patient believes or practices as far as that culture goes is to have a conversation with the person and talk to them about it. Okay, so the nursing health history provides a snapshot of the patient's perception of his or her health status and health needs, their healthcare needs. And so the nurse has to interview the patient to obtain the nursing health history. So the nurse must have good interpersonal skills to obtain sufficient and accurate information about the patient. The nurse must also know what types of questions to ask to obtain the desired information. And so, some of the things that you may need to ask during this initial uh, uh, interview, maybe you got to ask about biographical and demographic data. So, that could include the patient's name, their age, their gender, their birth date, their employment information, things like that or whatnot. Obviously, what's their reason for seeking health care, And so that's the patient's statement about his or her reason for seeking healthcare at that particular time or whatnot. Was their present illness or health concern? So after the patient states his or her reason for seeking healthcare, the nurse should probe a little further to gather additional information about the present illness. Um, what is their past illnesses, surgeries, and hospitalizations, things like that. You want to know about their marital status. Do they have any visual or hearing deficits? Do they wear dentures? Do they wear glasses? Things like that. Medications, information about the patient's medications that they may take. And it's important that you ask them about prescribed medications they may be taking, over the counter medications may be taking, herbal medications they may be taking, and recreational drugs, such as, do they smoke? Including, whether they smoke tobacco or whatnot, things like that. A lot of times when you ask about medication, people only think about prescribed medications, but you need to know all of those things, because all of those things can interact with one another and affect, the any treatments you may need to do for your patient. You want to ask about allergies. The patient should be asked to list any known medication allergies, prescribed as well as over the counter, any food allergies they may have. A lot of times when patients are asked this question, they only think about medication allergies. And so it's important that the nurse ensure that the patient understands that the information is about all allergies, food, animal, environmental allergies as well. So you need to think about all those things. What's their current health or lifestyle patterns? And so the client's health practices, such as their eating habits, their exercise patterns, do they do self examinations? Do they use any preventative health resources? Things like that. Their family history, that helps to provide information about the health status of the patient's immediate blood relatives, such as their grandparents, their parents, their siblings, things like that. And so this information helps to identify the patient's risk of having certain health problems that tend to run in the family. What's their environmental history? It's important to find out what type of community, work, or home environment the patient is accustomed to. And so, because maybe are they exposed to certain things in the environment, asbestos or, lead or, different things that they could potentially be exposed to. Um, do they use alcohol, or like I said, any recreational drugs or things like that? Their psychosocial history. Um, the psychosocial history provides information about the patient's beliefs and their support systems. And so, we want to, get information about that as well. Um, so, it should be that initial health history assessment should be pretty comprehensive and include, all of those things we've, identified. Okay, so a part of your initial assessment will include a review of the systems, and so the review of the systems portion of the health history allows the nurse to collect information about various body systems, head, neck, chest, heart, lungs, abdomen, genital, urinary, the extremities, musculoskeletal, endocrine, things like that, or whatever. And so the review of the systems can focus on one or two systems, or it can include all systems. The nature of the healthcare visit and the type of healthcare issues the patient is experiencing will influence how detailed the review of the systems will need to be. And so the information that's collected during this review serves as a valuable guide to determining how to proceed with the physical examination portion of this health assessment. And in your book, box 22.1, as far as if you're talking about the interview phase of it, it gives you some things that you may want to ask. As far as these go. Like, for example, if we're talking about head and neck, you're going to ask about headaches and dizziness. Do they have problems with their ears and things like that? If we're talking about chest, do they have a cough or do they have a pacemaker, things like that. And so it goes on to, different questions that you can ask during the interview um, phase of it before you actually do the physical assessment of it. For example, if we're talking about abdomen, do they have frequent indigestion, gas, bloating, things like that? Um, so take a look at that box as well. So for some questions you may want to ask as a part of the physical data when you're doing the interview phase of it, things you may want to gather subjective information on. Okay, the physical assessment is a significant source of objective information when we're actually performing our physical assessment. The nurse uses inspection, auscultation, palpation, and percussion to obtain information about the patient's health status. And so the information that's gathered from the physical assessment can be used to determine the patient's level of health and physiologic functioning, arriving at a preliminary nursing diagnosis of a health problem, confirming a diagnosis of dysfunction or a disease or something of that nature, indicating specific body areas or systems for additional testing. So if you need additional testing, a physical assessment can help determine that. Evaluate the effectiveness of prescribed treatment and therapy, and observing any adverse side effects. Monitor for changes in the body function. So your physical assessment is going to allow you to do all these things. And also it determines whether there are any signs of abuse. So remember, as nurses, you will be mandated reporters for child and elder abuse. That doesn't mean that you have to investigate yourself. If you have a suspicion, then you're required to report that. So it doesn't mean you have to have proof. It just means I suspect it, so it's my responsibility to report it. If I don't report it and it comes back that I suspected it, then I could have some repercussions myself for not reporting it. In your book, on box 22.3, there's some signs and symptoms of possible abuse. It goes through signs and symptoms of possible abuse for children and adults. For example, evidence of physical injuries or neglect, such as bruising or fractures, poor hygiene, dirty clothes, malnourishment, things like that. Injuries that are inconsistent with the explanation of how they happen. Um, so child's inappropriate response to an examination question, such as pulling away from touching or looking at the caregiver. Those could be some things when it talks about the older adult: dehydration, malnutrition, evidence of burns or neglected pressure injuries, bruises to the upper arms and trunk. So, these are some things. Fear of their caregiver. Are they afraid of their caregiver? So these are some things you would look for that you suspect abuse. And so, like I said, it's not required that you have proof. It's only if you have a suspicion or suspect it, then you're required to or mandated to report it to the proper authorities. Okay, the first, like I said before, the techniques you'll use in the physical exam: inspection, palpation, auscultation, and percussion. But as an LPN, you're probably not going to use percussion because it takes a special skill to really understand what you're listening to with percussion. But inspection is going to be the first thing we always do. And remember, I said inspection starts as soon as you enter the room. And so it involves using the senses to make observations regarding the patient's health status. So what do you see? Um, what do you see or whatnot? A multitude of information can be obtained using this technique. And so when you walk in the room, um, do you see the patient crying? Do you see the patient resting? Do you see the room in disarray? Do you see, what do you inspect? As soon as you walk in that room, you start your assessment with the inspection part of it. general observations during the conversation, and it continues, throughout the assessment process. You continue to observe different things, um, as you're examining your patient. When you're inspecting specific parts of the body, it's important that you take note of the size, the shape, are they symmetric? Um, Additionally, to maximize the benefits of information that you obtain, you as the nurse should have a good knowledge of what's considered normal characteristics as they relate to the particular observation that you're making. For example, if the nurse doesn't know the normal color of the sclera, um, of the eye is white, then if you observe a sclera that's yellow, then it wouldn't be considered a significant finding to you. So it's important that you understand what's considered normal or not. So you're going to be observing, the general appearance of the patient and different body parts, the contours, the skin tone, the skin color. Do they have rashes? Do they have lesions? Do they have scars? Do you see any deformities? Are they limping when they walk? Like I said, are they crying? Or, what are you observing? So inspection is the first thing you're going to do when you in your assessment piece of it. Okay, palpation is the act of using touch to obtain data during the health assessment. And so you're actually, touching the patient. And so you could be assessing things such as skin turgor, body temperature, texture, size, shape, um, do they have any muscle spasms, pain, or tenderness when you're touching them? If you know that an area is painful or tender, then you want to palpate that last. You're palpating for, is there any swelling? Do they have edema, pitting or non-pitting edema? If there is edema present, do you feel a mass? Do you feel a growth or anything like that? Palpating, do they have any restrictions in body part movements or things like that? And so you can do light palpation, which is about half an inch um, below the skin surface, and then deep palpation, which requires enough pressure to palpate about 1 to 2 inches, and you're trying to palpate the underlying organs below the skin surface. And so you always want to do light palpation first. And when you do deep palpation, you can do one or two hands. It just depends on you as the examiner how comfortable you are using one or two hands or whatnot when you're doing that. Okay, so percussion requires touching or tapping an area of the body with the fingertips to evaluate the size, the shape, and makeup of the underlying structures, trying to determine is it air-filled or solid or whatnot. You got two types of percussion: direct percussion, which involves tapping the skin surface directly with the fingertips, or indirect percussion, which requires the use of both hands. And so the finger of one hand is placed against the skin surface of the area to be percussed, while the fingertip of the second finger from the opposite hand is used to tap on the skin at the base of the nail bed with the first finger. And so, like I said, you're trying to assess the size of organs, the location of the organs, the density of the organs, and the presence of air or fluids or things like that in the area. Okay. So auscultation involves listening to sounds that are produced by the body with or without the assistance of aids. And so auscultation is usually the last of the four basic techniques to be performed, except when you're doing an abdominal assessment. Auscultation is going to be performed before you palpate and percuss, because when you palpate and percuss the abdomen, you're going to change the bowel sounds. So you want to auscultate before you do those things and change the pattern of the bowels. Um, So you as the nurse, you need to have a knowledge of what sounds are normal or abnormal in order to be able to evaluate significant findings during the auscultation phase of the examination. Although, as a novice nurse, you may not be able to determine what specific abnormal sounds are being heard, you still need to be able to at least report the presence of something that's not normal. So you should know what normal sounds are so that if you hear something that's not normal, you can, report it to your registered nurse or whatnot so that they can come and listen as well. And so when you're auscultating, you need to listen for loudness, frequency, duration, the quality of the sounds. Um, Listen in a quiet environment. Practice listen as much as possible. That's how you'll get better at understanding or identifying what's abnormal or not. And know how to properly use the stethoscope. When you're using a stethoscope, you want to place the earpieces in your ears so that they point forward toward the nose when you're listening. So things you might be listening to, you might be listening to lung sounds, um, heart sounds, and like I said, abdominal. So your bowel sounds are different things you'll be, listening to. Okay, olfaction, that's another technique we may use in our physical examination. Olfaction just means the use of smell. And so we might smell um, uh, breath odor. So, a fruity breath odor might indicate diabetic ketoacidosis. If they have alcohol on the breath, that could provide you some clues as to why your patient is lethargic or irrational. Um, a foul mouth odor could indicate periodontal disease or, just poor hygiene or things like that. And so also your wound odors, if you have odors coming from the wound, that could indicate infection or whatnot. Vaginal odors could indicate vaginal infections. So you're going to be using olfaction as well as a part of your physical assessment. Okay, so your basic physical assessment is going to include a few things. Your basic physical assessment is going to include height and weight. You want to obtain height and weight without shoes. And then for infants, you want to make sure they don't have a diaper on so that you can get an accurate weight. Make sure you never leave those infants alone or unattended on that scale. Also, your basic physical assessment is going to include your vital signs, obtaining vital signs. So remember those, your heart rate, your respirations, your blood pressure, your temperature. Remember, pain is considered your fifth vital sign. Also, when you're doing vital signs, you can do the O2 saturations as well. And basic physical assessment can include head, neck, chest, heart, lungs, skin, extremities, abdomen, and genital. And we'll go through each of these here in a second. Okay, so the head and neck um, is going to include, when we're doing our head and neck assessment, that's going to include um, your eyes, your nose, your mouth, your throat, your ears, all those things. So we're going to check for the size and shape of the head, visual acuity, the nose, is it symmetrical, things like that, the mouth, um, the color of the lips, things like that, the neck, what's the muscle strength, things like that. Do you feel the lymph nodes? We'll go in deeper detail with the head and neck assessment in a later chapter. Pupils, are their pupils equal, round, react to light and accommodate, checking for perla, do they wear hearing aids, do they wear glasses, questions you might ask, does the nose seem stuffy, is there any drainage, do the teeth appear clean, um, does the patient have difficulty hearing, like I said, we're checking for perla, things like that, when was their last eye exam, and things like that as well are things that we would include in our head and neck assessment. Okay, so the chest examination, that's going to include an assessment of the external chest, which will also include heart and lungs, can include breast tissue as well. So the nurse should inspect the anterior and posterior chest wall. Make sure you're noting this. Is it symmetrical in the chest movement? Are there any lesions or discoloration or things like that? Lung sounds, you're going to be auscultating lung sounds, which we'll talk about in more depth in a later chapter as well as heart sounds are going to be assessing. And we'll talk more in detail about that as well in a later chapter. But we're looking at the aortic heart sound, pulmonic, Erb's point, tricuspid, and mitral. But like I said, we'll talk about that in a later chapter as well. You're looking for spine curvature. So do you see lordosis, kyphosis, scoliosis, things like that? Does the patient have dyspnea, meaning do they have difficulty breathing or do they have shortness of breath? What's the apical pulse like? So remember we said the apical pulse is left midclavicular, fifth intercostal space. So we're assessing that as well. So, all those things will assess in our chest, heart, and lungs assessment. Okay, lung sounds should be auscultated over the anterior and posterior chest wall with the stethoscope. The chest wall should be percussed and palpated for the presence of abnormal vibrations and to determine the degree of chest expansion. The nurse should also make note of the specific location of any abnormal breath sounds. And so the order of the examination should proceed from one side of the chest to the same location on the opposite side of the chest, then down, then back to the other side of the chest to directly across from the last area that you auscultate. And so this will allow for you to compare between the various lung fields, make sure each side is equal, and we will, further identify that in a later chapter as to how to exactly perform that assessment. So you're looking for normal sounds. You'll hear your bronchial sounds, which are normal. They're heard over the trachea, and then you'll have your bronchial vesicular, which are normal sounds that are heard over the upper portion of the lungs, and then your vesicular sounds, which are normal and heard, throughout the remainder of the lung sounds. And so adventitious sounds will be abnormal breath sounds that you could possibly hear, such as wheezing or stridor or rhonchi, things like that. And like I said, you'll be able to listen to, some adventitious sounds to, kind of identify what's normal and abnormal as well in your patient. Okay, so skin and the extremities. So if your skin has breaks or lesions in it, then you can wear gloves um, to assess the skin or whatnot. You can do it all at once, or you can do it with each body system. So, for example, as you're doing your chest assessment, you could be assessing the chest at that time, and go throughout, the whole time as you're assessing the patient. But we're going to be inspecting the skin for do they have any rashes, lesions? Do they have any open wounds? Do they have any bruises, dryness, signs of dehydration? So, we're assessing skin turgor, which is your skin elasticity. So you're going to be looking for all those things. Um, Checking for capillary refill. Capillary refill is when we press down on the nail bed and how quickly does the color return. And so normal would be less than 3 seconds. If it's more than that, then they could have some circulatory issues or whatnot. You're going to be assessing your peripheral pulses. Don't forget, you need to know where all your peripheral pulses is. So remember your temporal, your carotid, your brachial, your radial, your popliteal, your dorsalis pedis, your posterior tibialis, your femoral. So knowing where all of your peripheral pulses are and make sure they're equal bilaterally. And so you can check them both at the same time, except remember when you're doing the carotid, you only want to do one at a time because you don't want to decrease blood flow to the brain. So make sure you understand that as well. And so, do you see any discoloration in the skin? You should also be assessing for edema. Does your patient have edema? If they do, is it pitting or non-pitting or whatnot? So all those things will be a part of our skin assessment. Okay, so remember, the order of the abdominal examination is modified so that auscultation is performed before palpation and percussion. So you're going to inspect, auscultate, palpate, and then percuss, because the bowel sounds may be affected by the palpation and percussion. So you want to auscultate before that happens. And so to successfully perform this portion of the examination, the patient should be relaxed. So in a dorsal recumbent position, lying on their back with their knees bent and feet flat will facilitate relaxation for the abdominal assessment. And we will, you know, uh, show you how to, do this properly as well in lab. The abdomen is divided into four quadrants or four regions using the umbilicus as the center point. And so the nurse should listen for bowel sounds in all four areas of the abdomen. Um, so when you're performing your abdominal assessment, when you auscultate, and when you palpate, you want to start in the right lower quadrant, work your way up to the right upper quadrant, then over to the left upper quadrant, then down to the left lower quadrant, because this is the pattern that the bowel follows. And so if there's anything in the colon, you want to move it in the direction of going out instead of pushing it back up into the colon. So that's the direction you want to auscultate: right lower, right upper, left lower, auscultate and palpate. You should hear 5 to 30 sounds a minute. Anything less than 5 sounds a minute, bowel sounds a minute, will be considered hypoactive. Anything greater than 30 bowel sounds a minute will be considered hyperactive. And before we say a person's bowel sounds is absent, we need to listen in each quadrant for 5 minutes, because if we say that they don't have any bowel sounds, we're saying there's a real problem going on here. And so we want to listen in each quadrant for 5 minutes before we say absent bowel sounds. You should be palpating. Is it soft? Is it hard? Is there any tenderness? Do you feel organs? You shouldn't feel organs when you're palpating. And if you do, that means organs are swollen or whatnot. So we're palpating for, all those things as well. So typically the genital, anal, and rectal area are not assessed unless the patient has a particular complaint in those areas. But if you're bathing the patient or performing any type of perineal care, anything like that, assisting them to the toilet, you can always perform an assessment um, of the area at that time. So this is just a systematic way to perform an assessment just to ensure you don't forget any areas or whatnot. Your book defines it as RNS HOPE. So R stand for rest and activity, things you might see in your book. There's a box 22.6 to show you what types of things you would assess in each area. So we're talking R, rest and activity needs. You might assess their muscular strength, their balance and equilibrium. Do they have pain? Things like that. N is nutritional status, their fluid and electrolytes. So things you might assess under that area: height, weight, caloric needs, general body appearance, their fluid intake, fluid volume. Do they have edema or things like that? S is safety and security. So things you might assess in there is their risk for injury. Do they have sensory deficits, muscle weakness, things like that. Um, H is hygiene and grooming. Under hygiene and grooming, you might assess their ability to bathe, dress, and groom themselves. Do they have any preferred routines or things like that? O is oxygenation and circulation needs. So things you might assess under there: do they have a cough? What's the rate and depth of their breathing? Um, What are their breath sounds like? What's their blood pressure? What's their level of consciousness? What's their orientation to reality? Their blood pressure? Do they have jugular vein distension? Things like that. What are their peripheral pulses like? And then P is psychosocial and learning needs. So things you might assess under their desire for spiritual assistance, their support system, their mental outlook, do they have financial worries or fears or concerns or things like that. And then E is for elimination and things you might assess under there. What's their urinary output like? What's their bowel movements like? So when we're thinking elimination, that's urinary and bowel. Every shift should be performing some type of assessment on their patient. So you should be, doing some type of assessment on your patient every shift. And in your book, box um, 22.7, they provide a shift head to assessment, things you should be doing in your every shift. So, uh, initial observation, what's their skin color look like, appearance, affect, what's their respirations, their ease of respirations, looking at their head, checking their vital signs, checking their pain, chest, so auscultating lung sounds, listening to their abdomen, doing an abdominal assessment, extremities. If they got tubes, you're going to be assessing those tubes like an NG tube, a catheter, a trach, things like that. What needs do they have? Assessing their needs. Do they have their call light? Do they have tissues? What's their room temperature like? Things like that. So every shift should be doing, this type of assessment on their patients. Okay, so if a patient is unstable or they're experiencing some type of life-threatening event, a focus assessment um, is performed, and so it has the goal of obtaining enough information to meet the immediate health needs of the patient. And so just remember, it can be completed in a short period of time. And it's appropriate when the patient presents with life-threatening conditions or whatever. So is there cardiovascular issues and you need to do a focus assessment on that? Is there respiratory issues and you need to do a focus your assessment specifically on respiratory issues or whatnot? Are they experiencing pain? Do I need to do a focus assessment on their specifically on their pain, whatever issues that they might be having at that time? So, question one, Maggie's patient has been receiving dialysis for several months. She has a dialysis shunt in her left arm. When taking vital signs on her patient, it is important for Maggie to remember. The answer is three. Blood pressure should be obtained in the right arm only. Never take a blood pressure on an arm that has a dialysis shunt or on the same side of a mastectomy or lymph node dissection, or if the patient has a patent IV, patent meaning that there's actually fluids going in through that arm. If the patient has an elevated blood pressure, you should not take it on the same side as the shunt. And you may repeat it on the same side in a few minutes. Uh, if it's still high, then you're going to notify the healthcare provider. Question two. On auscultation, Maggie notices her patient has bronchi in her lungs bilaterally. Bronchi can be described as. The answer is two coarse, low pitched rattling sounds caused by secretions in the larger air passages. And so that's what ronchi are. They're described as coarse, low-pitched rattling sounds that are caused by secretions in the larger ear passages. A wheeze is a whistling, musical, high-pitched sound produced by air being forced through a narrow airway. And then stridor is a croaking sound that's heard when there's a partial obstruction. And then crackles are fine or coarse sounds that are high-pitched. Okay, so as the LPN, you will be involved in patient education. Initial education should be done by the registered nurse. So the registered nurse will do initial education, but you as the LPN can reinforce education of your patients. So you can reinforce, teaching that the RN has already started. And so, some things you might be educating your patient on. You might be educating them on the need for regular physical exams, recommended periodic diagnostic tests, the need for immunizations, dental exam, necessity for dental exams, warning signs of cancers, when notify their primary care physician of different things like that or whatever. While you're doing your assessment, it's a good time to teach health promotion. When we're talking about teaching health promotion things, if you're doing, for example, an eye exam, then maybe you teach them about doing their annual or whatever the recommendation is for their age, their eye exams. You're assessing their mouth. That's a good time to talk about doing your regular cleanings or whatnot. So as you're doing your assessment, that's a good time to, do your teaching on your health promotion. Okay, so you need to make sure you understand different positions. A lot of times, the question might just give you the particular position and you might not understand how to answer it because you don't know what positions is. In your book, figure 22.13, it shows you what each position looks like. So make sure you understand what each position looks like. For example, supine, you can see there lying flat on the back, prone on your stomach, dorsal recumbent, on your back with your knees up and feet flat, lithotomy position, Sims position, knee chest position. So make sure you understand what each of those positions look like. Also, make sure you drape your patient to prevent unnecessary exposure of the body parts. For example, if I'm assessing uh, the patient's legs. I don't need the whole body exposed. I can have the upper part covered and just the legs exposed. Or, if I'm doing a breast exam, I don't need both breasts exposed at the same time, only the breast that I'm examining at that time. So make sure you draping your patient and provide them proper dignity and privacy during the examination. Okay, so a neurologic check. Anytime you have a patient with a head injury or brain surgery or something like that, you need to be performing neural checks, especially like when you have your older adults. That's why a lot of times in your long-term care facilities, they should have some type of policy if your older adults fall and hit their head, that you should be doing neural checks on them. But anybody really with head injuries or brain surgeries, you need to be performing neural checks on them. And so that's going to include a few different things. You should be assessing their level of consciousness and their cognitive ability should be evaluated. The cranial nerves are tested. And so I have posted on Blackboard on how to do a complete neurologic assessment. And so make sure you do take a look at that as well, and or how to assess your cranial nerves rather. Take a look at that on how to assess your cranial nerves. The reflex responses are assessed as well. Make sure the patients relax to assess their reflex responses. And so you're also, remember we talked about checking for PERLA, pupils equal, round, react to light, and accommodate. You should be assessing that. A part of that neural check is your Glasgow Coma Scale. There's in your book, table 22.3, it talks about how that Glasgow Coma Scale is assess. You can check to see there. We're checking for eye opening, their motor response, and their verbal response as well. And based on their response to each one, they'll receive a number. And so you can receive a number all the way up to 15. And so the higher the number, the more aware or more conscious they are. So the better, the higher the number, the better. The lower the number, the worse their brain functioning is. If the number is less than 8, then that person is considered comatose, meaning they're not responding at all. If it's less than 8, they're going to be comatose. So you want that Glasgow Coma scale to be higher in your patients that have had head injuries. Okay, a systematic way to perform an assessment is to use the acronym RNS HOPE. Which letter is correctly defined? The answer is 2, oxygenation. So remember, RNS HOPE stands for rest and activity, nutrition, um, safety and security, hygiene and grooming, oxygenation and circulation needs, psychosocial and learning, and then elimination.